you guys, Dr. Nicole here, talking to you today about what is chronic prostatitis and really can pelvic floor physical therapy help you? The answer is absolutely yes. And we're going to go over a little bit of what chronic prostatitis actually is and what it is not. And then sort of the conundrum you guys might be in if you've been hearing like, I might be diagnosed with interstitial cystitis, but I thought that was just for women. And then we're going to talk a little bit about how the pelvic floor can be involved in your symptoms. So we're talking today about, so there's different types of prostatitis, right? Prostatitis means inflammation of the prostate. So a couple of types, type 1, type 2, there's a bunch of types before type 3. And because there's some subcategories as well, but that basically means that there is an infection or an inflammation of the prostate itself that is due to like an actual infectious process. So that is what prostatitis is. Now, type 3 chronic prostatitis is basically chronic non-bacterial prostatitis. And what that means is there is no bacteria. You do not have an infection either of the urinary bladder or the prostate itself, but you have symptoms like you do, right? So urinary urgency and frequency and pelvic pain are the two main categories of chronic prostatitis. Now, just like in interstitial cystitis, and I highly recommend that if you guys are watching this video, you go back and you look at the interstitial cystitis video that we've also done, because we're basically going to cover a lot of the same things. But chronic prostatitis, just like in interstitial cystitis, the bladder gets blamed for a lot of the pain. In chronic non-bacterial prostatitis, your prostate gets blamed for a ton of the symptoms when actually it's probably not the issue. So, you get in these rounds of antibiotics for an infection that doesn't exist, but you have symptoms, right? And so what the heck is that? And what's your best course of action? Well, there's a lot of debate, which is becoming not very debatable anymore, about can men really get interstitial cystitis? Is chronic prostatitis and interstitial cystitis the same thing or two different conditions? And what we're sort of finding out now with the most recent research is that interstitial cystitis and chronic prostatitis are probably the same condition. And if not, they're so similar that it's almost not worth even distinguishing between them. So there was a study that was done as part of a huge epidemiological study for interstitial cystitis that looked at a bunch of men and found that basically over 90% of people that had been diagnosed with chronic prostatitis could also meet the diagnostic criteria of interstitial cystitis. So conversely, less than 10% of people that had been diagnosed with chronic prostatitis wouldn't have IC, right? So there's a huge overlap of symptom presentation. There's a very small subset of people, which, is a little bit interesting to even think about, like what are those 10% of people have? But the diagnostic criteria of interstitial cystitis basically covers chronic prostatitis symptoms. And so basically the gold standard for treating chronic prostatitis is not rounds of antibiotics for an infection that doesn't exist, but rather pelvic floor physical therapy that can address some of the pelvic floor muscle components that might be driving the urinary urgency, frequency, sexual pain, testicular pain that might be associated with this chronic prostatitis symptom presentation. And if you actually look at the anatomy, you can see like why this might be happening. So anything that you see here is red, that those are pelvic floor muscles. Now, we don't happen to have a male pelvis, but you guys, honestly, we're pretty much the exact same in terms of anatomical similarities with the pelvic floor. Where the vagina is here, right here, that's basically where the base of your penis is. And then you obviously have your penis here, but the actual muscular structure is exactly the same. We even have the same muscles. So this that goes around the base of your penis is called the bulbo cavernosus or bulbospongiosis. This is the ischio cavernosus spongiosis. You have that same thing. You have a superficial transverse perineal muscle. You have urethral sphincter muscles. You have basically the same thing that I'm seeing here. So what's interesting is that just like I showed in the interstitial cystitis video, if you look at where the pelvic floor muscles come up right behind your pubic bone, and really what would be sort of, in the area like right at the base of where your penis is, then that's where also the bladder sits. And so if there's irritation in these pelvic floor muscles, or over spasming or holding patterns or something like that, that can actually cause bladder irritation, urinary symptoms, urinary hesitancy, and all of those sort of prostatitis-like symptoms. So over 90% of people with chronic prostatitis have pelvic floor dysfunction associated with it. It can cause all sorts of other things, some of which you might be blaming on your prostate, right? Testicular pain, groin pain, perineum pain, painful sitting, urinary hesitancy. If your urine stream goes kind of all haywire and it's all sprayed out, that can mean that your pelvic floor muscles aren't fully relaxing to allow the urethra to open up very well. It can cause painful bowel movements, and all kinds of other hip dysfunction and stuff. So really what the goal of this video is to get you to start to think about is that if you've been diagnosed with chronic prostatitis, that you get to a pelvic floor physical therapist that knows how to treat, number one, men, and number two, pelvic pain. Sometimes we're a little bit hard to find on that male front because everyone kind of thinks about pelvic PTs for just needing to be after babies and stuff. But at our practice in Orange County, we treat over 30% of our patient population as men, and we can really help a ton with all of the symptoms of chronic prostatitis in the absence of an infection. And so if you find that you're in this sort of weird cyclical, like, I think I have an infection, no, I don't, yes, I do, no, I don't, and you really aren't getting managed well by your urologist, you might want to consider going to a pelvic floor physical therapist to see if some of your symptoms are actually being caused by your pelvic floor. I hope that's helpful. Please reach out to us if you have any questions at all. And I hope that this has encouraged you to look into pelvic floor physical therapy as an adjunct to your medical treatment. Thanks.